So yes, wheezing, allergies, asthma are rising at a really high and alarming rate in the last couple of decades. And there is mixed evidence. So the systematic reviews find some studies showing a benefit from breastfeeding, others not so much. I think a lot of this is because we haven't done a good job of really defining breastfeeding and defining our outcomes. So many studies rely on a parent report of asthma, or only look at any breastfeeding versus no breastfeeding. But what we've been able to do in the child study is dig a lot deeper on both sides. So on the breastfeeding side, we know exactly how long the mums have breastfed for. We know if it's exclusive breastfeeding or partial. And then on the outcome side, we have really good documentation of wheezing, asthma, and allergies. And so what our data are showing is that there is a protective effect and that it's dose dependent, meaning that every month longer that you breastfeed, you get more protection, and every bit more of breast milk that you give is beneficial. So even if you can only do partial breastfeeding, that's still better than none. And I think that's a really important message because there are recommendations for 6 months exclusive breastfeeding. I think our data support that that is a good recommendation, but at the same time, I think a lot of mums might, in the first few days after giving birth, look at that recommendation and say, I'm not going to make it, I have to go back to work or I have other priorities or it's too challenging. And so then maybe they give up. But I think that's the wrong attitude. I think any amount you can do is beneficial. And I think there is pretty convincing evidence that there is a benefit. So we saw, for example, if a baby was breastfed for 6 months exclusively, they had a 67% reduced risk of wheezing in the first year of life. It's a really large effect size. And we saw it was especially true if the mom herself had asthma, meaning those babies were already at the highest risk, and you could significantly reduce that with breastfeeding. By providing a bovine product, are we adding a new exposure to bovine protein? We are. Is that what's more important, or is it more important that we're missing all of the other things in human milk? It's probably a combination of both, I would say, because a baby would not normally be exposed to bovine proteins, so that might be inducing sensitization and allergy, but at the same time, it's missing all of these other important human factors. So oligosaccharides are one great example. Cows and all other mammals make some oligosaccharides, but cows make about 40, humans make over 100. So there's something special about the human milk composition that is missing if a baby's not receiving human milk. So I think that's really important. And the other thing is, even thinking about human milk, it's not all the same, right? Each woman produces a different, slightly different composition of milk, and even the same woman produces different milk over time, and even in the morning versus the night. Like, it's truly incredible how personalized and complex human milk is. There's no way to replicate it, and it's really important for the infant. Wet nursing. So that's an interesting question, right? And I think we in Canada or Sweden might think that's a crazy idea, but this happens very regularly in other cultures, Mongolia, for example, and other developing countries. So maybe it's not so crazy after all. I think human milk is probably always the best alternative. Of course, we have to think about safety and other concerns, but I think it's something that you might see more of in the future as we increase our understanding and appreciation for just how powerful human milk is for the infant.